Hello everyone, this is Dr. Kunal Siradha, Advanced Laparoscopic and Robotic Colorectal Surgeon. Today, I'm diving into a recently published multicenter study on ArtiSential assisted right hemicolectomy. If you've ever wondered whether articulating laparoscopic tools like ArtiSential can really bridge the gap between conventional laparoscopy and robotics, this presentation is for you. I'll be breaking down the methodology, results, and what this means for our practice, especially when balancing cost, complexity, and oncological safety. This study was conducted by Dr. Sejong Kim and colleagues across multiple centers in South Korea. As we know, minimally invasive surgery, or MIS, has transformed the landscape of colorectal surgery. Compared to open surgery, MIS offers smaller incisions, reduced pain, quicker return to normal activity, and shorter hospital stays. However, MIS is technically challenging, particularly in colorectal procedures. This is largely because conventional laparoscopic tools are rigid and inflexible. This restricts movement, limits precision, and can increase surgeon fatigue, especially in deep or narrow pelvic spaces. To address these limitations, robotic platforms like the Da Vinci system were introduced. They offer enhanced dexterity, tremor filtering, and three-dimensional vision, but they also come with a major downside: cost. Robotic systems are expensive to purchase, maintain, and operate, making them inaccessible in many institutions. This brings us to the ArtiSential system. In the next slide, you can see what makes this device unique. The ArtiSential is a handheld articulating laparoscopic instrument. It is designed to replicate the natural wrist movements of the human hand. It can bend in all directions up to 90 degrees, offering a full range of motion in a confined space. In the instrument photos, you can appreciate the articulated joints, which allow for far greater maneuverability compared to standard laparoscopic tools. The surgeon controls these movements directly with finger and wrist motions, making the learning curve intuitive, especially for those already skilled in laparoscopy. While ArtiSential offers a mechanical solution to the rigidity problem, its real-world performance and clinical value still needed to be evaluated. The objectives of this study were, first, to assess the learning curve of ArtiSential use in laparoscopic right hemicolectomy, and second, to compare its short-term clinical outcomes to those of conventional laparoscopic surgery. This was a retrospective multicenter study, with prospectively collected data from January 2021 to October 2022. 3 high-volume tertiary hospitals in South Korea participated. Each case was performed by an expert surgeon with over 20 years of laparoscopic experience. Patients included had right-sided colon cancer. Patients with stage IV disease or hereditary syndromes were excluded. Standardized enhanced recovery protocols were followed in all centers. The study looked at operative details like time, blood loss, and anastomosis method, as well as postoperative recovery parameters, time to flatus, time to oral intake, complications, and hospital stay. They also evaluated oncologic adequacy, including margins and lymph node harvest, and economic metrics like total and out-of-pocket cost. The learning curve was analyzed using QSUM analysis, which plots cumulative deviation from the mean operative time, allowing identification of the point where proficiency is reached. To reduce selection bias, the authors used propensity score matching, resulting in 165 patients in each group. One group underwent ArtiSential assisted right hemicolectomy, the other underwent conventional laparoscopic surgery. Now moving to the results. A total of 511 patients were included, 167 in the ArtiSential group and 344 in the conventional group. After matching, baseline characteristics were similar in both groups: age, sex, BMI, tumor stage, and comorbidities. All patients had at least 12 lymph nodes harvested, and resection margins were identical at 13 centimeters in both groups. Operation time was also equal at 148 minutes. Estimated blood loss was slightly lower in the ArtiSential group, 50 milliliters versus 75 milliliters, but this difference was not statistically significant. One key difference was in the method of anastomosis. Intracorporeal anastomosis was performed in 57% of ArtiSential cases, versus 0% in the conventional group. This was statistically significant, suggesting that ArtiSential allowed surgeons to perform more technically demanding tasks with greater confidence. There were no conversions to open surgery in the ArtiSential group, compared to 0.6% in the conventional group. This difference was not statistically significant, but still notable. Postoperative recovery was similar in both groups. Time to flatus was 3 days. Time to diet and length of hospital stay were also comparable, 6 to 7 days on average. Complication rates were low. ILS occurred in 6.6% of ArtiSential cases, versus 1.8% in the conventional group. This approached significance but did not reach it. No significant differences were noted in anastomotic leak, bleeding, reoperations, or readmissions. There were no deaths in either group. Regarding cost, the total cost of ArtiSential assisted surgery was about $6,949, compared to $6,282 for conventional laparoscopy. Out-of-pocket expenses were also slightly higher in the ArtiSential group, $1,305 versus $983. These differences were not statistically significant. The learning curve analysis showed that proficiency with ArtiSential was reached after 19 cases. This is relatively short compared to robotic right hemicolectomy, which typically requires 27 to 44 cases for proficiency. So what does this mean? This study demonstrates that the ArtiSential system is safe, feasible, and a cost-effective alternative to both conventional laparoscopy and robotic surgery. It offers comparable outcomes, no increase in complications, and a manageable learning curve. Looking again at the photos of the instrument, we can now better appreciate how its design may have contributed to these results. The ability to replicate natural wrist movement while maintaining tactile feedback is a significant advantage. This makes complex tasks like intracorporeal suturing or dissection more ergonomic, especially in narrow spaces like the mesentery or around the iliacotic pedicle. Unlike robotic systems, which can cost over $16,000 per case and have high out-of-pocket costs, ArtiSential adds flexibility without a dramatic increase in expense. It does not require large capital investment and fits easily into existing laparoscopic workflows. However, this study does have limitations. It is retrospective, group sizes were uneven before matching, and there may have been underreporting of minor complications. Also, all surgeons were highly experienced, so these findings may not be generalizable to trainees or junior surgeons. The extent of ArtiSential use within each procedure was not quantified. It is unclear whether it was used throughout or only for specific steps. In conclusion, the ArtiSential system is a promising tool in the minimally invasive armamentarium. It bridges the gap between conventional laparoscopy and robotics, offering articulation and precision without the financial burden. Further prospective randomized studies are needed, especially to evaluate long-term oncological outcomes. But based on this study, it appears to be a viable and scalable solution for laparoscopic colorectal surgery. Thank you.